sorry, I didn't mean to wake you up. How are you feeling? A little bit better than yesterday. I'm glad. Well, I would like to introduce myself first. My name is Nurse Matt, and I will take care of you tonight, if that's okay. Okay? I'm just reading the report from the other nurse, and if it's okay with you, I do have a few questions. Well, first I would like to verify your date of birth and your full name. Okay. And your date of birth. Okay. Okay. I found you in our system, and I'm just gonna go ahead for a few seconds and read the report from the previous nurse. I want to make sure that I have all the information needed. Okay. So it says here that you fell yesterday and you were in the emergency room. Okay. Your vital signs were abnormal. You had very high blood pressure. Okay. And you're experiencing some blurry vision and double vision. Okay. And you also hit your hip while falling down. Okay. And you have a bruise on your left arm. Okay. Okay. I think I have the whole picture now. So I'll be able to provide you with the best treatment plan that I can for this evening. Okay. Well, first I would like to start by taking your vital signs. Okay. Are you having any pain at the moment? On a scale of 0 to 10, how would you rate your pain? 0 being no pain, 10 is the worst pain. A 2, okay? And I'm going to first take your temperature. This goes on the forehead. So just stay still. Okay, wonderful. You don't have a temperature, 98.5. That's perfectly normal. And now I'll take your oxygenation. This is called a pulse oximeter. I'm going to first turn it on and put it on your finger. I'm just gonna need your index. Okay. Good. Just try to take a deep breath in. So your oxygenation is normal, 98% on room air, and that's very good. Your heart rate is 78 beats per minute. That's also normal. Okay. I'm going to put the cuff on your arm. Do you have a preference? Okay, in that case, let's go ahead and use the left arm. Just try to relax and keep both feet on the ground. Okay, very good. Your blood pressure is normal, 125/62. And is it okay if I listen to your heart and your lungs since I already have the stethoscope with me? Okay. So I'm going to put the stethoscope on your chest. Is that okay? Okay. So just try to breathe normal. You don't have to take a deep breath in because we're just listening to your heart right now. Okay. Very good. Very strong heartbeat. I'm not hearing any abnormal extra sounds. No S3, no S4. Okay, and I'm able to hear S1 and S2. That's very normal. I'm gonna go ahead and switch it up. We're going to listen with the bell. We're looking for murmurs. And I'm not hearing anything abnormal. That's good. Okay, I'm gonna switch it up back to the diaphragm. And now I'm going to listen to your lungs. So take a deep breath in and exhale. Very good. One more time. Take a deep breath in and exhale. Good. And I'm gonna move the stethoscope a little bit to the side. So just take a deep breath in and exhale. And now I'm going to put the stethoscope on the other side of your chest, on the lateral side. Take a deep breath in and exhale. Okay, very good. Your breath sounds are also normal. I couldn't hear any signs of pneumonia, infiltrates, or anything like that. Okay. Wonderful. Okay. Let's go ahead and begin our medical exam. Okay. I'm going to start with the head area and I'm going to move down the body. Can you please show me where exactly you're hurting? I just want to make sure that I'm not touching you too much over there. Okay, so it's right here in the back of your head. Okay. I will do my best to be very gentle when I palpate your head in that area. Is it okay if I touch your head? Okay, so just relax. You can close your eyes if you want to. I'm touching you right here in the back where you said it hurts. Okay, I'm just trying to be as gentle as possible. There seems to be a little bit inflamed and red on that side, so I can definitely note asymmetry around the head and the face. Okay. Now I'm gonna go ahead and palpate your face. Let me know if you're feeling tenderness, pain, or any kind of sensations. No pain when I did that. Okay, now I'm going to palpate exactly around your eyes. Are you having any pain? No. What about here? No. Okay, very good. Now I'm gonna go ahead and palpate right underneath your jaw, and I'm looking for any kind of lymph node enlargement, okay? So just try to stay as still as possible. Okay, so I'm not noticing any lymph node enlargements. That's very good. And let's go ahead and check your face with light. Okay. Great. So I'm not noticing any abnormal skin changes, which is very good, very reassuring. And now I'm going to check your facial sensation. So can you please tell me if you feel this? Do you feel it? Okay, that's good. Now I'm gonna do the same thing on the other side. And did you feel that? You did, okay. Let's go ahead and check your facial sensation on your chin. Did you feel that? A little bit tingly, okay. And on your forehead. Did you feel that? Okay, very good. Okay, now we're going to check some reflexes in your face. This is called neurological hammer. It's not going to be painful at all, but if you're having any kind of pain, just let me know and I can stop. Okay, so very slowly I'm going to tap on your face, and I'm looking for some reactions on your muscles, and if I do get a reaction, then that is a positive result. Okay, very good. Good. Great. Good. And one more on your nose. Okay, so your neurological response is very good, within normal limits. Now I'm gonna go ahead and check inside of your mouth. So I'm gonna ask you to open your mouth as wide as you can, and I'm going to push down on your tongue. Good. Say ah. Good. Okay, very good. So I'm not noticing any skin abnormalities. Tongue is midline, the uvula is midline. Okay, the amygdalas are not inflamed at all. No lumps noticed. Okay, no cavities. I am gonna check your teeth if that's okay. Okay. So this is just a mirror, and I'm going to be able to visualize the teeth in the back of your mouth. And with this one, it's not sharp at all. I'm just going to slowly tap on your teeth, and I want to make sure that you're not sensitive, that you have no pain. Okay? So just give me a big ah while we do this. Okay, so I'm just gonna tap on your teeth. Let me know if you're having any pain. I'm gonna start in the back, all the way in the back. Good. And just going to move down. One more tooth. Good. And slowly approaching the front teeth. Good. Any discomfort when I do that? No. Okay. Let's go ahead and continue. Any pain? No. Good. Okay. And now I'm gonna go ahead and check your upper teeth. So I'm gonna just same thing. I'm gonna start from here and in the back. Good. Good. Okay. Did you feel any pain while doing that? Wonderful. So it seems like you don't have any cavities, which is really good. Now I'm going to check your eyes. It said in the note that you're having blurry vision and double vision. So I would like to first check your pupillary response, and for that I'm gonna need to flash a light in your eyes. It may be uncomfortable, but it's gonna be really quick. Okay? So just look straight at me, look right here at my nose. Okay, good. Look straight at me, look right here at my nose. Okay, very good. So your pupillary response is good. They're round and reactive to light. Now I'm gonna ask you to look at my fingers right here. Good. Then look at my fingers right here. Excellent. So you see both hands, correct? Okay. I'm gonna need you to tell me which fingers are moving, right or left. Okay? Good. Perfect. Excellent. Very good. Very good. 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 So that peripheral test is also intact. Now I'm gonna ask you to tell me when you don't see my fingers in your field of vision. Okay? So we're gonna start from here. Good. And just look at my fingers. Tell me when you don't see them. Now. Good. Now. Good. Now. Good. Now. Very good. Excellent. Okay. I'm going to do a pressure test, and for that I'm going to ask you to take a deep breath in and pinch your nose. Okay. Can you do that? Okay. So I'm just going to flash a light in your eyes. I'm going to need you to focus right here on the light behind me. Can you do that? Okay. So just keep on focusing on the light behind me. Very good. Okay. So I'm trying to visualize the optic disc. The optic disc seems to be intact in the left eye. Let's go ahead and check your right eye. So do the same thing. Pinch your nose and hold your breath. And try to look right here at my fingers. Okay, very good. Good. Okay, wonderful. So just look right here in the back. Try to keep your eyes open. Very good. So the optic disc is also intact in the right eye. Now we're going to go ahead and do the Snellen chart. I have the Snellen chart right here in the back. Do you see it? Okay. I'm just going to move a little bit so you can visualize it a little bit better. Is that good? Okay, so I'm going to ask you to identify the letters. Okay, very good. So can you please tell me what letter this is? Good. What about right here? Okay, very good. What about this one? Okay. What about the first letter over here? Good. What about this one? Good. And what about this one right here? You can't see that one. Okay. So we're going to go ahead and move up. Can you see this one? Good. Letter C. And what about this second letter on the same row? Okay. Excellent. So your vision is intact. 2020. Whatever happened yesterday, I think it's resolved. Okay. Now I'm going to go ahead and check your ears. And then we're going to check your nose as well, okay? Okay, so for this, I'm going to need you to turn your head a little bit. Good. Just like that. And I'm going to pull on your ear. And I'm going to take a look inside. And I'm trying to see if you have any fluid leaking. And I can definitely see the tympanic membrane. Tympanic membrane is intact, pearl gray. No signs of infection or inflammation. Good. You can look straight at me. Good. And now I'm gonna need to take a look in your left ear. So just look this way for me, please. Okay, very good. I'm just going to look in here and make sure that you don't have any infection or inflammation. Okay, so the tympanic membrane seems to be intact as well in this ear. And it's very clean. Looks very healthy. Tympanic membrane is pearl gray. Wonderful. You can return back to center. Okay? Good. So, I'm very excited about these results. Everything is normal. Okay. Oh, I said that I'm gonna take a look inside your nose as well. So for that, I'm gonna need you to look up. And I'm trying to see if you are having any deviated septum. You don't. No signs of infection or inflammation. Good. Okay. Just stay just like that. Okay. So the mucosa seems to be non-inflamed and it's very healthy as well. Okay, let me Go ahead and touch your nose. Any pain there? No, very good. Now I'd like to check your taste and your smell. Okay. So first we're gonna go ahead and check your smell. So I'm gonna need you to close one nostril and I'm gonna have you smell this. Okay, ready? And what does this smell like? Lavender. Wonderful. Okay, now I'm gonna ask you to open the opposite nair. Good. And I'm gonna ask you to identify the smell as well. What does it smell like? It smells like coffee. Wonderful. Okay, and now I'm going to check your taste. So I'll be putting just a few drops. They're all gonna be different, so try your best to identify them. So I'm just gonna put one drop on your lip. What does it taste like? It tastes like lemons. Okay, very good. And now I'm going to give you another taste sample. Okay, so just go ahead, open your mouth. Very good. What does that taste like? It tastes like medicine. So it's bitter. Okay, very good. Let's go ahead and try one more. I really hope that this one will be a little bit better for your taste buds. Okay. So what does that taste like? It tastes like coffee. Excellent. It seems like your taste and smell are intact, which is wonderful news. I'm going to write the note for the next nurse to make sure that she knows that our exam today was very normal. Okay. I was able to write the note, and now I would like to let you rest a little bit because this exam was very exhausting, I bet. Okay. Is there anything that I could get for you? A cup of tea? Sure. Absolutely. I'm gonna go and get that right now. Anything else? Okay. Well, thank you so much for allowing me to do this medical exam, and I apologize for waking you up. Okay, I will be right back with your hot tea.